Hey guys, Lauren and Rebecca here with Bizrok. In today's video, we're gonna kind of add to the team optimization training, right? Which is really, we're gonna focus on the front team. Now, I know previously we've talked about adding value for the front office and adding value for your role as a clinician, but I really wanna talk today about accountability. So Rebecca, what does that mean to you?
Accountability for the front area. Guys, the first thing you see when you walk in the office is going to be the reception area. When you walk in, you see that, and then you see the beautiful desk where everybody's sitting and they're welcoming you. But what's the first thing you also notice?
Usually sticky notes.
Right?
I'm like, oh,
they're
God.
everywhere. But it's the cleanliness, how
Yes.
organized everything is in the back. We kind of forget about that. And I think we pay more attention to the clinical space when we talk about organizing and cleaning areas, but we really need to pay attention to the office as a whole.
Yes.
So it's going to start right when the patient walks in. What do they see? Everything on the tables, in front of the couches and chairs, how tidy everything is. Do we have water bottles sitting around that a previous patient has left? It happens, guys. We have to check in between each patient. I can't tell you from experience walking into a dental office or a medical facility and I'm like, oh, somebody left their dirty bottles or there's a tissue on the floor. Patients notice it. So making sure it is very, very clean and very tidy is so important. Guys, when you're sitting in your area, your workspace, just turn around, look behind you. Make sure you don't have stacks of either papers that need to be scanned in. That's something we forget about. And or books of any kind sent behind us, mail that needs to be gone through. It's just simple things. Making sure we keep it organized.
I love that we're talking about this, and I want to kind of jump back to what you talked about earlier, which was the reception area and just having bottles from previous patients or napkins out in front, because people they just leave stuff around.
They do.
But my biggest pet peeve is probably the advertising pieces that chill out up front, or magazines. You've got the 30 different options to different magazines, which patients love. Like
They do.
Great.
They enjoy it.
But less is more, right?
I agree.
And then what's your thoughts on all of those advertisements and brochures and the best and latest, greatest in technology that we have in the practice, or Invisalign and all the different fun products? Because we've both gone in and we've seen brochures galore in some of our offices.
Yeah. So just like you said, less is more. Grab a few and you can do an item of the week. I love that. Advertise your technology small amounts at a time. So pick one or two things, lay out the brochures for those, and then change them either weekly, bi-weekly, or even monthly. It really, really helps. And keep everything rotating. That way everything looks pristine and crisp, and throw away the old and bring in some new. Patients have a tendency when they're holding things, they're going to start dog-earing. You know what that meaning? Pulling the pages down. They'll do that. It gets kind of dirty just from people's hands, and there's really no way that we can sanitize paper. So I just say put a few out and then keep the fresh ones coming. You can also get the clear organizers that you can put the brochures in, and that way you only can put a few in at a time, and you don't have 10,000 things laying on the table or on a side table or even on the floor. Just keep it minimum. So just very few things, rotating them bi-weekly or monthly keeps everything looking nice and fresh.
Love that. And one exercise that we usually take teams on is in the front is actually standing where a patient would, whether the patient's checking in or checking out or going to discuss treatment plans up front, so that we can put ourselves in a position to think and see what the patient would see, right?
Absolutely.
So what are your thoughts on that as far as keeping those areas clean?
When you walk into the office every morning, I always suggest going to the reception area, walking around, looking behind, just like you're a patient, checking in, seeing what they can see. Our days get busy. We get sidetracked. On the evening before, if everybody's in a hurry, which most are to quickly leave the office, they forget to do that once over. So do it first thing in the morning. That way everything is nice and clean. The other thing that is forgotten, I feel like a lot, is going to be your water bottles. If you have that, or a coffee station for your patients, keeping it nice and stocked. Bring everything to the front, making it look nice and clean and organized. So very important. Nobody wants to walk in with a dirty coffee pot, guys, or cups that are left from the previous day in the trash can, or maybe missed and on the floor, the little stir sticks. Small details. Keep everything stocked and fresh every single day. How many times have we had patients come up after a procedure? They have gauze in their mouth.
It's the worst.
They may have bodily fluids dripping out of their mouth. They don't know. They are numb. and it gets on the counter space, they just wipe it up with a tissue and keep going. So it's very, very important that we take the cabbie wipes that we have and actually sanitize our counter space and all of our knobs. We want to keep everything as sterile as possible. It is a medical facility, so we need to make sure we keep it very clean.
Well, and you do such a great job in your trainings talking about the front office actually having their own set or container of Cabicide wipes that you write front on it because the clinical team will take it, right?
We may have sticky fingers.
But you have that up front, so it's quick and easy to grab.
Yes.
But that also flows into patient care of the restrooms. And it's not just the clinical team's job, guys. It's everyone's job. Everyone's job is to serve our patients and to provide what we call an exceptional experience. So last thing as we wrap up this video, what is your kind of go-to or recommendation on checking patient restrooms?
Checklist. It's going to be the same thing as looking at the reception area, cleaning your countertops. I would add your restrooms to your checklist.
So true.
Rotate. You can rotate either every other week or weekly and have each team member grab a week. It's going to be their responsibility to check the reception area, sanitize the check-in and check-out desk, and also check the restrooms twice a day.
Love it. Well, as always, guys, please reach out to us if you need any help or support. Otherwise, we can't wait to see you and serve you soon.